Hey, I'm getting ready to do a video on bipolar disorder. I'm going to do a more one about the symptoms, the causes, the different types. The ones I've done a year ago were mainly my experiences. This is going to be more of just a general, like, what is it? What are the symptoms? What happens and different things like that. Okay, so I got this from the National Alliance on Mental Illness, okay, NAMI. And bipolar disorder, we know, is a mental illness that causes dramatic shifts in your moods. It's the energy and your ability to think clearly. Okay, you have highs, which are called mania, and lows, which would be depression, which they differ a lot from just the typical, normal everyday ups and downs that most people experience. The average onset of bipolar disorder is 25, but it can happen earlier in the teens, and even some children are being diagnosed now. Mine came on around 19 or 20, so and it usually has something that triggers your first episode. Okay, there's usually a traumatic or some kind of event that will trigger your first episode. It affects men and women equally, and there's about 2.8 million U.S. adults that experience bipolar disorder every year. Approximately 83% are they're classified as severe bipolar, which would be bipolar 1, I would guess. Bipolar 1 is the... So if it's left untreated, it usually gets worse. And that's what happened with me. I didn't get diagnosed until late, and so mine was harder to control. Because it gets worse, and every time you have an episode, it just gets worse and worse, and until you end up... it's harder to get under control. But if you have a good treatment plan, if it's caught early, you have good response to medications, you have a healthy lifestyle with plenty of rest, exercise, and you get enough, you eat well, you get enough sleep. People can usually live well with this condition most of the time. Symptoms and their severity, they can vary from person to person. A person with bipolar disorder may have distinct manic or depressed states, but also may have extended periods of normal, sometimes years without any symptoms. And a person can also experience both extremes simultaneously or in rapid succession. Now, if you experience both, like mania and depression at the same time, that's called a mixed episode. And I did a video about that. That's pretty awful. I wouldn't wish that on anybody. That's a horrible one. I've only had like one of those, and it was, I think, one or two, and the one really bad one where I had to be hospitalized, and it just makes you feel like you're going nuts because you got all this energy, but it's all negative. And it's, you have depression and anger and irritability, and it's not the normal mania where it feels good. And the rapid succession is this rapid cycling, which would be 4 or more episodes in a year, which that's quite a few. And severe bipolar disorder, it can have psychotic episodes, which is psychotic features. And in some cases, because that's where a person can hallucinate, auditory or visual hallucinations, delusions, sometimes they get wrongly diagnosed with schizophrenia because the only time people with bipolar disorder usually have these are during a manic or really depressed episode. Normally, the only time I ever had it was during the mania, like my real full-blown mania. But if somebody hasn't ever been seen before, and they're having, they're seeing and hearing things and stuff, and it's really bad, they could be misdiagnosed with schizophrenia. Sometimes that happens. But mania, to be diagnosed with bipolar disorder, a person must have experienced at least one episode of mania full-blown mania or hypomania. Hypomania is the milder form. It doesn't include psychotic episodes. You can usually function well. And, sometimes people have lots of these episodes of mania and hypomania, and sometimes people will only have them experience them rarely. Okay, most of the time, people when they find themselves in especially the hypomanic state, it's appealing because especially if you've been in a depressed mood for a long time, this feeling of elevated mood, it feels so good when you first have it. But the problem is it gets out of control very rapidly. It doesn't stay controllable. Your judgment becomes impaired. Behavior becomes more unpredictable and impulsive. People usually make reckless decisions and take unusual risks. Most of the time, if you're in a full-blown manic state, you're not aware of you've lost touch with reality. You're not aware of the negative consequences that your actions are causing. At the time, you're not. And what's really bad about the severe manic, it can become suicidal because it gets to the point where it just gets out of control. And so suicide is one of the main risks of this. And so you need to watch out. If you know somebody that's bipolar, if one of your loved ones or you are bipolar, if you start seeing signs and if you've had manic episodes before, you're probably going to start to be able to recognize when you're getting hypomanic, which then you can kind of, you probably need to get some sleep. You probably haven't been sleeping well, and maybe you've got too much stress. You got to do something to make yourself sleep and to calm yourself down, because and you can prevent it from becoming full blown manic. Because I've had hypomanic states before where I took one of my pills to sleep, and I made myself go to sleep because I knew I had to sleep. Or I took an anxiety pill because I had too much stress. Something, you can do something. Sometimes you can, sometimes it's just, there's nothing that it's just gonna, come on and you can't stop it. But, and then of course, depression, we need to pretty much know what that is. Usually the depression will follow the manic because what goes up has to come down. So, the depressions are often very, very debilitating. People are not able to get out of bed. A lot of times they can't. It'll be days, and they'll sleep and sleep. They'll sleep far more than normal. Just everyday life can be overwhelming. Decisions on what to eat, on getting dressed, on bathing, on whatever. And you got a lot of negative thinking, guilt, and helplessness. And there is a lot of thought of suicide in that. Obsessed feelings of loss. I mean, it's horrible. Yeah, it's not just like the normal depression. It's really, really awful. I've had it a lot, and it's debilitating. It's hard to function. So, but the depressive symptoms, are. They might stay in a person. They may present nearly every day for a period of at least 2 weeks. They have to be present for every day for at least 2 weeks to be diagnosed. You have to have one manic or hypomanic episode, and you have to have a major depression that's lasted at least 2 weeks every day. And depression is usually harder to treat than the mania. It was for me. I had depression for, oh my goodness, it seemed like forever. It was years, at least a couple years. That was just depression almost every day. Almost, it seemed like. I mean, there were some, of course, it wasn't every day, but it seemed to be, and it was more depressed than anything else. And it was very, very, very awful, and it was very hard to get out of it. what causes bipolar disorder? Genetics play a role. If your parents or your sibling, it's not an absolute that if your parent has it, you're going to have it, but you have a higher risk. And also stress, a stressful event, such as death and illness, difficult relationships, divorce. Something to trigger it. Like I said, you have to have some major event that triggers it. And then your brain structure. Okay, we don't really have a brain test yet, or brain anything but there are subtle differences in the average size and activation of some of the brain structures in people with bipolar disorder. But to diagnose it, you have to see usually a psychiatrist, and they will do a physical exam, and they'll take blood tests, and they will rule out any other illnesses that may be causing your symptoms. But you have to have this mania and this depression to be able to be diagnosed as bipolar disorder. And there are 4 types, okay? Bipolar 1 is the illness which people have experienced 1 or more episode of full-blown mania. Most people will have episodes of both mania and depression, and I have, of course. Most people with bipolar 1 have the mania and they have the depression. It's not necessary to have depression to get the diagnosis for bipolar 1, but you definitely have to have the mania. And your manic episodes must have had to last at least 7 days or be so severe that you require hospitalization. And then bipolar 2 is a subset of bipolar disorder in which people experience depressive episodes, shifting back and forth with hypomanic episodes, but never a full-blown manic episode. So you just have mostly depression and some hypomania. But the depression can be horrible, and it can be really debilitating in bipolar 2. You can have more depression than you do almost in bipolar 1 sometimes. It just depends. So it's not really a better. It's just you don't have the full-blown manic. And then there's cyclothymic disorder, which is a chronically unstable mood state in which people experience hypomania and mild depression for at least 2 years. People with this have brief periods of normal, but these periods last less than 8 weeks. So they only have brief periods of normal moods. Most of them, they cycle back and forth just between mild depression and hypomania, which it seems like that would be hard to deal with that too. So, and then there's bipolar disorder other, unspecified, which is when a person doesn't meet the criteria for 1 or 2 or cyclothymia, but still experienced periods of significantly abnormal mood elevation. Okay, so that's the different types of bipolar disorder. Okay, so the treatment for bipolar disorder is psychotherapy, such as cognitive behavioral therapy and family-focused therapy. Then there's medications, there's mood stabilizers, antipsychotic medications, and to a lesser extent, antidepressants. Then there are the health approaches such as aerobic exercise, meditation, prayer, support, meditation. Oh yeah, I said that. Any kind of health, approach. Like I've heard that certain, like fish oil is supposed to help with your moods. There's different types of natural things you can do. You just have to look those up. I have taken fish oil before. I don't know if I don't really know if it helped that much, but I probably didn't take it long enough to know. But some people really swear by those kind of things rather than, but most people if you have bipolar disorder, you're going to have to stay on some kind of mood stabilizer and antidepressant probably, yeah, definitely. Okay. Anyway, and sometimes, like, I have an anti-anxiety medication to take with mine because I have a lot of people have anxiety, too, along with the bipolar. I mean, it causes anxiety. It causes, and sometimes you have ADHD, like I have that. Sometimes people have PTSD. There could be co-occurring illnesses, and that would make it even harder to control. It's harder to treat. I mean, but ADHD is common.